Hi guys, so I just wanted to do the quickest summary I can about chapter 2, which is four-handed dentistry, making sure that you are not missing any key points. Okay, and so you are at this point supposed to be able to process the whole appointment from beginning to end in your head. Okay, so even from getting the patient's x-ray up to knowing what treatment you're setting up for, your patient's last name, calling them back, seating your patient, and bibbing your patient. There's like nothing to think about between there, okay? So don't forget to bib your patient before applying topical, okay? So you bib your patient, and then you would apply topical, making sure that you're applying topical in the buccal vestibule, which is going to be the injection site. Okay, so that's very important. You don't want to place it right down their tooth or on their gums. Make sure that it's up at the buccal vestibule where the injection is taking place, okay? You're setting your needles for the long for the lower, LL. So that's how I remembered it. Lower long, short for the upper, okay, which is going to be your 30 gauge short, 27 gauge for the lower. So again, at that point, you should have set the room for whatever it is that you're doing, which should include your isolation techniques, typically cotton rolls. So have your cotton rolls together. You are going to need more cotton rolls on the top, on the bottom more than the top because of the tongue. You're putting 2 on the bottom on the lingual and on the buccal or facial, okay? But there's always going to be 2. And for the maxillary, there's only going to be 1. So of course, depends on where you're prepping. That would depend on how many cotton rolls you prepare. Some other isolation techniques that's mentioned is the stebdopter, which is an aid for suctioning. Very, very traditional. There's newer, modern suctions just like it. I'm not quite sure what the name is. I can't remember. But it is an isolation technique because it keeps the tongue away from the tooth. And then the rubber dam, make sure that you remember the 5 things, okay? So at this point, you just are to remember the 5 essential materials needed for placement, which is gonna be your actual rubber dam, your rubber dam frame, your rubber dam punch, your rubber dam forceps, and your rubber dam clamp, okay? And when it comes to the clamp, make sure you go back on my page is 21. But you go back and make sure you look at the 4 different clamps, remembering where they are to be placed. For the upper molars, you would set 14A, okay? Please remember your positions. Remember that you are sitting highest up. Don't get in a chair and try to adjust your chair. You should be up as the assistant. Next is the doctor or the dentist. And then last is your patient. You are to oversee, have control over that bird's eye view angle, the situation, protect the tongue, protect the cheek. You should be seeing things before the doctor sees them, and you cannot have that advantage if you're sitting directly, at the same level as the doctor. So make sure that you're sitting higher. Yes, it feels weird. Yes, you're sitting high, all of that, but you're supposed to feel that way and you get more comfortable, okay? So the transfer zone, 4 to 7 across the patient's 4 to 7 chest, safest place to pass it. You never want to pass across the face. Very dangerous. Something, acidic could fall onto the patient's face. So make sure that you're practicing 4 to 7 right below the patient's chin, smoothly and confidently when you're doing that, which leads me to the four-handed transfer. 3 things: palm up, pinky out, instrument parallel to the patient. Make sure you're retrieving properly and delivering your instrument with control, letting the doctor know, hey, I got you. Here's your next instrument that you need. Of course, anticipation of the next instrument comes with time, girls. Don't give yourself a hard time thinking you're supposed to remember and know everything. You will not. Maybe you will. We can hope for the best, but it's difficult to do at first. So I would just say wait, but after a few times, you got to get with it. You got to be able to anticipate and remember what they need next, okay? Just like your friend, you guys have been friends for how long and they still put in pickles on your hamburger? Like, why? I don't like pickles. But at first, when you guys first met, you might not, they might not have known that about you. But year 5, 6, 7, you guys going out to eat, friend, I don't eat pickles, okay? So, it's the same thing. It's like they're going to expect certain things of you as time goes on. And that's expected in really any relationship that we have. You know, expectations grow. Anyway, so doctor zone, transfer zone, assistant zone, making sure that you're practicing instrument transfer using 2 hands from the tray to 1 hand to the doctor, back, tray. It's like an L, okay? Making sure 2 hands, 4-handed dentistry for a reason. You're not just using 1 hand, stretching and hurting your back over time, all right? And then your HVEs per quadrant, you should be positioned properly. So quadrants 1 and quadrants 4, you should be coming and sitting on the lingual side. Okay, 1 and 4, you're on the lingual. For 2 and 3, you are going to be on the buccal or the facial. Okay, so maximize your suction by keeping that bevel to the tooth, parallel to the tooth, facing the tooth, collecting all of that debris and things like that. Okay, so practice makes perfect. All right, I want you to stay motivated. You think big, you get big. Stay excited, study, make your flashcards, ask your questions, use your instructors, check your emails, check your Google Classrooms. I mean, we are here for you as much as you allow us to be. But we thank you, and I hope this video was helpful to you. And it's Miss Ruby signing out. Thank you, divas.